when I was able to gather more information about her belief system, um, it gave me more information about why she was experiencing some of the things that she may have been experiencing, and it wasn't necessarily psychosis.
Thank you, Marcella, for joining us today out of your very busy schedule to join us in this very important topic. And I hope that all is well down in good Charleston, South Carolina.
Yes, you are very welcome, and I appreciate you guys for having me on today. And all is well. All is well.
Right. Well, let's get started here. We have some questions from our audience here. Tell us a little bit about your background and how you became involved in integrating culturally centered care within healthcare.
Yeah, so I'm a licensed professional counselor here in South Carolina, and I'm also a licensed clinical mental health counselor in North Carolina. I've been in the mental health field now for over 20 years, working in different capacities. And in working in those different capacities, I've been privileged to sit in many, many team meetings,
Mm,
interdisciplinary team meetings to really come up with effective care plans for the clients that we're serving. And so the experience of working as a part of a team where there are many experts from different areas, different service providers, whether it's mental health, medical doctors, education leaders, there's value
mhm,
in being able to work collaboratively together to make sure that we are addressing the full need of
mhm.
our clients.
Absolutely. What has been your journey in addressing cultural considerations within various healthcare disciplines? What motivated you to pursue this path?
Yeah, so just from my experience of seeing how effective being able to come to the table with all of these other experts
Mhm,
and really address the need of the person as a holistic approach kind of shaped and molded in the way that I approach the way I deliver services.
mhm,
It's important to have the full story of our clients. And it can be really easy to use our own perspective, like have our own perspective of something and not really understand exactly what our client is. Like not every person in the Black community have the same experience,
right.
or not every
No.
person in the Indian community have the same experience. So
Mhm,
really approaching each client with a blank slate, really wanting and getting to know who they are, their
mhm,
beliefs, their morals, their values, their experiences is really important when we're talking about service and really assessing what it is that they need.
mhm. Right. So you pretty much were seeing some of the gap in some of the services probably needed addressing culturally too, it seems.
All right. So a biopsychosocial assessment is one of the most powerful tools that any service provider can have because it provides us with so much information from different facets of our clients' world, right? And
Mhm,
as a service provider, it's important for us to be able to operate from a lens where we're in their world so we can really assess, especially from a mental health standpoint. There are so many different things to consider when we're talking about mental health treatment, and cultural is one of those things. Their belief systems is one of those things. Because I can easily, from the outside looking in, and a prime example, recently I had a client who had I not learned more about her religious beliefs,
hmm.
she could have easily been diagnosed with maybe psychosis.
Wow.
But when I was able to gather more information about her belief system, um, it gave me more information about why she was experiencing some of the things that she may have been experiencing. And it wasn't necessarily psychosis. It was because of her belief. And so things like that is important to know and to understand so that we can avoid misdiagnosing our clients, so that we can make sure that we're getting our
Mhm,
clients what it is that they need.
mhm. Great points, valid points there. How have you incorporated and prioritized culturally centered care into integrated care models? And how has that impact patient outcomes?
Yeah, so when we're talking about working with our clients and outcomes, for me in my field, mental health, rapport is everything. Being
Mhm.
able to connect with our clients really open up a window for us to be able to really gather all of the pieces to the puzzle to be
Mhm.
able to give them the most effective treatment. So again, back to that biopsychosocial assessment, that tool is an evolving tool. I think sometimes certain service providers may feel like, okay, it's a one and done thing, right? Like we do it and it's over,
Right.
but it evolves. So I use that as a foundation in the beginning, but I also amend it as I gather more information. The more you're working with these clients and they're trusting you more, you learn more and your perspective shifts and changes. And that data is valuable when you're talking about treating them. So going back to that biopsychosocial assessment is powerful because we can make those amendments and it gives us more information again that we can also share with this team, this interdisciplinary team that we're working with to provide them with the most effective services. So I like to connect with my clients' providers. I like to stay updated on the medications that they're taking, any
Mhm.
diagnosis, medical diagnoses they may be having, because all of those things are something that I have to consider when I'm thinking about their overall mental health.
Mhm. Okay. What are some of the biggest challenges you have faced in integrating culturally centered care into traditional healthcare settings, and how did you overcome them?
Yeah, so I would say one of the biggest challenges is when you're dealing with insurance companies, it becomes a numbers thing, right? And you can only bill for certain services for a certain amount of time. So I would say that that is definitely a challenge that I've ran into in the mental health field in
Mhm.
private practice, because when you're talking about that initial assessment, back to that biopsychosocial, you're only allowed to do that once every
Mhm.
12 months, right? So really being able to incorporate gathering that information and assessing as I go, along with providing interventions so that this is still considered something that's billable. And I think with a lot of other service providers, they're only given a certain amount of time, especially like with our medical providers. They're not able to provide an hour and a half or 2 hours that
Mhm.
it may take to really get a in-depth biopsychosocial completed. So I would say that funding is probably one of the biggest barriers. And a way that I kind of overcome it is coming up with creative ways to be able to still assess my clients as I go while pairing that with interventions so that we're able to bill for that time.
What innovative approaches or best practices have you or others implemented in delivering culturally centered care, and what results have you seen?
Yeah. So when we're talking about like practices, I would say just working from it as a care coordination, care team approach.
Mhm.
Um, I think that's the best approach when we're talking about giving our clients the most effective services all the way around, medically, also mentally. And then I work with a lot of children and families, so I would say educationally as well. Being open to sitting down with these other service providers or experts or supports that the family have and really working collaboratively as a team to provide them with what it is that they need.
Okay. And what would you say to healthcare providers, primary care providers, that are providing medical services, psychiatrists, that multidisciplinary team? What points would you point out about the importance of indulging in really learning culture in medical practice in order to get pretty much those successful outcomes?
Just making sure that they keep their like an open mind when they're talking about their clients, being
Mhm.
able to really get to know their clients, build a rapport with their clients, get the full scope, the full story of their life and their experiences. Um, no preconceived notions, right? If a client come in and they share something about themselves that maybe they're not familiar with, you know, my favorite question to ask a client is, oh, well, help me understand that, right? A client come in and say, well, no, I don't believe in this. I believe in this. Oh, if it's something I know that I'm not familiar with, I ask my clients, help me understand that to get their perspective. And then I also do the research. Professional development is important, cultural
Okay.
competency trainings. Um, all of that is good to help us to learn how to work with this melting pot of people and clients that we have in society.
Mhm. Absolutely, absolutely. And I think from looking at some of my experiences, really knowing we're learning the culture, but there's also a culture regionally where people live. Either in the South are very different than in the North or out West. So just there's little subcultures within those different pockets of pretty much around the country that we should learn as well. Because as you say, not all people are the same, even though even we, have the same hue or anything like that. Um, really getting, everybody's different. So thank you for enlightening us on that, on the
Yeah.
importance to primary care providers.
Yeah, and just to add to that, I'm so glad you brought up subcultures because that is also that is very important, right?
Mhm.
Within these bigger cultures are subcultures, and that even goes to families. Every family household has its own culture and beliefs and ways that it operate, and so that's also important to consider as well when we're talking about culture and even down to like professions. I've worked with a lot of military families. Military life
Very
is
different.
its own culture.
It sure is. Mm.
Yeah.
Right, right, absolutely. What future innovations do you see in the integration of culturally centered care within healthcare, and how could this impact the healthcare industry?
Yeah. What I would love to see is, you know, medical providers, mental health providers bridging that gap and working together collaboratively more. Um, there are so many different things that as a mental health provider we have to consider that can impact a person's emotional and mental well-being.
Right.
And their physical health is one of those things, and it's vice versa. And I think that in order to make sure that we're not missing any of those pieces to the puzzle, like just working together
Mhm.
would be very valuable for our clients.
Thank you. Thank you for enlightening us on that. I appreciate all this information. It's definitely brought awareness back to not only myself, but pretty much to the audience about the importance of really knowing and understanding and researching culture and not to get lost in just a blanket approach because all of that could impact, the perception, address any implicit biases, the whole nine,
Mhm.
uh, and just having the services that's culturally centered and focused on those various cultures is so important. And as you mentioned earlier, that you mentioned that if you didn't know the young lady's religious aspect of service, of her pretty much her care and of her life, you would have misdiagnosed. So there's no telling how many people have actually been misdiagnosed due to that of understanding as far as even religious or subculture religions.
Mhm.
So thank you for pointing that out. And we thank you for coming today, giving us some of your time out of your busy schedule. We know you have a lot of things going on, and we see you in the community doing some great things. And we look forward to continuing this collaboration and pushing integrated healthcare around the country, around the world. So
Yeah,
thank you. Thank you for coming.
you're very welcome. Thank you for having me. I appreciate the podcast, the platform. I love what you guys are doing just with putting the information out there because this is very important and it's needed. So, well wishes with all of you guys' future endeavors with what you're doing here on this platform as well.
Well, thank you. Thank you. And to our audience, thank you for coming out, for sharing this moment. Please like, share, and subscribe to this podcast. We will see you at the next podcast. This podcast is brought to you by Cummings Graduate Institute for Behavioral Health Studies. CGI is celebrating 10 years of disrupting behavioral health care education to improve the way the world experiences healthcare.